Hello guys, it's your girl Rachel Chove from Zambia. Today we are going to talk about depression. Yes, depression. Depression, it's something that most people have experienced in one way or another. We see it around the people around us, even just ourselves have gone through some type of depression at some point in our lives. Now, what is depression? Depression, these are persistent feelings of sadness, worthlessness, and hopelessness. I hope these words are understood. Sadness, hopelessness, and worthlessness. So, most people, as I have said earlier, have experienced this, but this doesn't mean that that person is depressed. Now, how can we know that this person or I am depressed? We can know if the symptoms of depression, 5 or more symptoms of depression, last for over a period of 2 weeks and more. Yeah, so now we move to the causes of depression. You may wonder, what causes depression? What causes depression? So the actual cause of depression, to which we can point at that is the cause, has not yet been discovered yet, but there are many causes of depression that have been identified over the past years, some of which are maybe a serious medical, or not maybe, some of which are serious medical condition. Let's say, for example, you've been diagnosed with cancer. You may start thinking maybe you may be hopeless, thinking that any day I am going to die, and that can cause depression. You can find that you lose your loved one. You lose your loved one, for example, your parents, your siblings. You may feel you are going to be depressed because you're going to think, how am I going to survive life without this my significant other? Family history of depression. If you find that in your family most people have been suffering from depression, then you are at risk of having depression. Other causes are physical, mental, emotional abuse, even sexual abuse. It can cause depression. Sometimes age. For example, what causes depression in older people? Living alone. You may feel depressed and feel like you are lacking support, lack of support. So it's just the connection from age. Older people, we know mostly older people, they live alone. Then you may feel lonely and feel like nobody's supporting you. In the end, you end up being depressed. Some medication. I'm not going to mention any medication, but some medication, they can cause you to be depressed. I'm just going to explain how, but I'm not going to name the medicines. There are some medications that lower the dopamine levels. For example, those that are used to treat mania, such types of medicines, and some they lower the serotonin levels, and we know that when those are low in the body, that's what causes depression. So these things are just interlinked. So some medications, they cause depression. Then there's substance abuse. For example, alcohol, it causes depression also. So the way alcohol and other substances cause depression, it's just like these other medications that I've talked about. So they lower the serotonin, dopamine, and norepinephrine levels. Yeah. Then, so we are done with the causes of depression. Now we move to the symptoms. How can you know that this person is going through depression? So everything changes, the lifestyle and everything. And some of the things that changes for you to know that this person is depressed are changes in behavior such as sleep. If somebody used to sleep a lot, maybe they'll stop sleeping a lot. Some at night and during the day, which is called at night, it's called insomnia. When you can't sleep, if you used to sleep the whole night, maybe you just sleep for 1 hour and the rest of the time you are awake. Change in appetite. Some may start eating less and some may start eating more. Even the energy levels, like you won't feel that energy to do anything. Concentration. People who are going through depression find it difficult to concentrate in whatever they are doing. So mostly you find that they are absent-minded. Even when you are talking to them, they won't even hear what you are saying. Self-esteem. They may express this through talking. They may talk about it, and even their actions. They may feel low about themselves and everything. Some even have thoughts of suicide. You may find that the person is just thinking of ending their lives. They may even talk about it. And you may even see in some behavior, some may leave a suicide note and all those signs. Hopelessness, you may see that this person has lost hope in life, loss of interest in activities. You find that this person has lost interest in the things that they used to like doing. They will stop doing them. Weight gain or weight loss, this comes about weight gain. As I had said earlier, some they start eating a lot and some they reduce the amount of food that they eat. So if you eat more, you gain weight. If you eat less, you lose weight. And lastly, we go to the treatment of depression. You can use antidepressants. These are the drugs that are used in treating depression. They simply just increase the serotonin, dopamine, norepinephrine levels in the body so that your mood can be up there. You can also use psychological methods such as cognitive behavioral therapy, which is all about changing the way that the person thinks in order to change the behavior. Yes, changing the way the person is thinking in order to change the behavior, because according to the person who made this theory, they believe that people act or people do the things that they do because of what they are thinking. So if you change the way someone is thinking, you also change their behavior. You can also use anxiolytics, anti-anxiety drugs, anxiolytics. Most people who are undergoing depression, they also usually have anxiety. So you can also treat that. And also you can use antipsychotics. These antipsychotics, find that most people have psychotic features such as maybe eating habits, the concentration, they reduce the concentration, and all those other psychotic features that you're going to notice. So you can give them these for us to treat those. And lastly, if you've tried all the treatments, you can also use electroconvulsive therapy. This is used when all the methods have been used and it's not working out, the person is not getting okay. So how it works, we don't know, but all we know is that it works. Electroconvulsive therapy, this is just a therapy where they use electricity in order to treat something. There are a lot of things that this method is used to treat, but that's another topic for another day. For now, we are going to end here.